No doubt about it. Moms work hard and often don't take enough time for themselves. So how can the most important woman in the family do a little something that will make her feel good about herself? And it won't take a lot of time. It will also last for years. Well, Dr. Christopher Maloney of Maloney Plastic Surgery is here to tell us about something that might be right for you. Welcome, doctor. Good morning.
Good morning.
Mommy makeovers. This sounds like fun. First of all, though, let's talk about you. Tell us a little bit about yourself, your background.
Well, I was raised here in Tucson, Arizona, went to college in San Diego, and went to medical school at Columbia, New York. Then I did my general surgery training at Vanderbilt, followed by my formal plastic surgery training at Harvard and Boston. And I've been here in Tucson in private practice since 2002.
All right, a local boy. Mommy makeovers, these sound like fun. What exactly is a mommy makeover?
Mommy makeover is sort of a catchphrase describing a woman who's had children, who's now finished having children, whose body has basically been decimated by childbirth and being pregnant. And basically what we're talking about is a woman who's had children, whose breasts have gotten larger and then now smaller or changed shape, as well as their abdomen, body, flanks, thighs, hips. That whole sort of area can change significantly, so that even when a woman gets back to her pre-pregnancy weight, the changes in her body can be, quite alarming and quite different from where they started off. So oftentimes a woman will come in and have multiple things that they want addressed. And basically what we're talking about with the mommy makeover is what are some things that we can do to enhance a woman's body, basically from the chin to the knees.
Oh, wow.
And that's sort of a large area that we start with, but we do that and show them before and after pictures and really customize a plan for each individual woman to fit the needs that they have.
And when you're looking at that large an area, what are some of the typical areas that you most commonly see addressed?
Well, really, you're talking about the breast and the abdomen. So somebody who wants a mommy makeover is basically talking about enhancing their breasts and flattening their stomach.
Sure.
So those are basically the two main things. However, that being said, there are a lot of other smaller components that need to be added to that. A woman's breast enhancement may or may not include an implant like the ones we have demonstrated here, but they also may not. It may be a lift alone. And then a tummy tuck may just be a simple tummy tuck, but it may also involve liposuction of the flank areas on the sides or the legs or other areas of the body as well.
Flank areas.
Correct.
Okay. Let's talk about your props here. Explain the difference, if you would.
Sure. There's two different types of implants that we would commonly use for breast enhancement surgery or breast augmentation. This is a saline implant. It's a silicone shell that's filled with salt water. The advantage to this implant is it's significantly cheaper, but the disadvantage is that oftentimes there can be some visible rippling, and there's a much higher rupture rate because if it gets a hole in it, it's certainly going to get smaller. The silicone gel implants are the newer silicone implants that are available. It's like a gummy bear or a cohesive gel implant, so if you cut it in half, the material sticks together and doesn't migrate anywhere. It has less visible rippling, a more natural feel, and is probably the most popular implant in the United States used today.
So you're seeing a lot more women opt for
Yes.
this? And certainly every mom is not a great candidate for a mommy makeover. Who, though, would you say would maybe make a better candidate for this?
Certainly people that do not smoke and that take good care of themselves are the best candidates, because oftentimes these surgeries can be quite extensive if you're talking about combined procedures. And although combined procedures are safe, certainly a patient's safety is most important, so we want to make sure that their heart and lungs are healthy, that they're overall healthy, and that they're basically good candidates for a surgical procedure.
And when you're talking about these combined surgeries, what are some of the things that women really need to consider before they go through some of these processes that are going to maybe dramatically alter their bodies?
Well, first of all, you have to understand it's a major surgical procedure. I mean, some people, underestimate, plastic surgery and think that you just go in and have a nip and a tuck and you're done. But it actually is major surgery, and we take it quite seriously. We work in an accredited facility with board-certified anesthesiologists, and hopefully the patient picks a board-certified plastic surgeon. So we take it quite seriously, and patients have to understand the risks as well as the recovery, and they have to actually understand the expectations. Patients that come in that have unrealistic expectations are not going to be able to get a result that they're looking for.
Sure. And as for recovery time from breast augmentation, what does that look like?
Really, the recovery from just breast enlargement, which is breast augmentation, or a breast lift, is going to be about a week or two, depending upon, how rigorous someone's job is or how quickly they have to actually get back to their normal activities. But it's an outpatient operation. Patients go home the same day, and they actually recover quite quickly.
And what about tummy tuck?
The tummy tuck is an operation that does take a little bit longer to recover from, because we are tightening the muscles back together in the midline, and that can cause a little bit of a longer recovery and a little bit more soreness. There's also some drains that we commonly will place for a week or two, and that can sometimes be a little bit cumbersome getting around with drains.
What's the most common thing that you see moms come in after childbirth looking to maybe spruce up, to be colloquial about it?
Well, I think the most common thing that moms are concerned about has to be their abdomen. Because what happens after childbirth is, even though a woman will get back to their pre-pregnancy weight, they will still have that stretched abdominal wall and excess skin, so that even in the gym, occasionally they'll get asked, oh, I didn't know you're pregnant again, and it can be very troubling to a woman. So that's usually the most alarming thing, is that no matter how many sit-ups they do and how much they work out in the gym, they can't really enhance the abdominal area.
Right, I can't imagine how frustrating. All right, doctor, thank you.
Thank you.
And if you are thinking about enhancing your look, just call Maloney Plastic Surgery, 298-2330, or go online, maloneyplasticsurgery.com. And if you mention you saw them right here on The Morning Blend, you can get your consult fee waived. Again, just mention you saw them on The Morning Blend when you call 298-2330, or go online, maloneyplasticsurgery.com. And don't go anywhere, The Morning Blend will be back in just a couple of minutes.